Good evening. My name is Lisa Danna, D as in David, A-N-N-A, Brennan, B as in Baker, R-E-N-N-A-N, and I am a resident of Wheaton, Illinois at 108 East Jefferson Avenue. I have lived in DuPage County and nearby Elk Grove Village for most of my life. I am here in support of opening Haymarket Center of DuPage and to share with you my relevant, lived experience as a woman raised by drug addicts in biking distance of this town hall. I want to share with you not just the tragedy of losing both my mother and my father to the ravages of heroin, but also the cost to the community of failing to address drugs, and especially opioid addiction. My twin sister and I were not the only victims of my parents' and my uncle's addiction. My grandparents, public school teachers, police officers, medical professionals, social workers, and taxpayers everywhere paid the price. They housed us, clothed us, fed us, protected us, educated us, and I am forever in their debt for the beautiful life that I now lead. To be clear, addiction is not a socioeconomic issue 30 miles away in Chicago. Addiction is blind. It's an equal opportunity destroyer. It's like a tornado. It may only kill 2 or 3 people, like in my family, but it takes down half the town with it and the community's resources to rebuild it. Unfortunately, my family is not an anomaly. You can see it in the ever-rising statistics of addiction death in DuPage County. And there are many more of our neighbors still abusing drugs, but still alive, but abusing right now as I speak to you this moment. We all want it to stop, but no one wants to take the treatment center. Every community cries, not it. And so I ask, if not you, then who? It sounds like a lot of you are worried about the resources that go into Haymarket, but I promise you, you are already paying those bills. My mother was arrested for drugs and incarcerated for 6 months when my sister and I were only 7 years old. That's when we received what was then called welfare. We never had our own home. We had no health insurance, so we went to the emergency room for treatment, which rises the medical bills for us all. My sister and I attended 7 different schools before we graduated. Teachers parented us, and the school paid for our lunches, extracurricular activities, and field trips. Emergencies happened. We called ambulances that we could not pay for. We called police. We saw therapists at the Kenneth Young Center for free. We couldn't pay our utility bills. We went to college. We got Pell Grants and scholarships. Those are all community and taxpayer resources that we all pay when we can't eradicate drug addiction in our communities. We are all paying those bills right now. Sure, you could blame my parents, but the fact was they couldn't get treatment. Do you have any idea how expensive it is to get addiction treatment? Any idea? My sister and I were schlepped along to the closest methadone clinic to our home, which was all the way in Chicago. It was too far, it was not convenient, and it didn't last. At 19, I stood in the emergency room of Alexian Brothers Medical Center, begging for my then hallucinating mother to be admitted to their hospital just long enough for her to detox so she could get treatment while sober. She had no insurance. She was on Medicaid. So the highest level of practitioner who could treat her was a social worker, not a doctor, no medical doctor. After I left, they released her. And she walked home in the cold, still hallucinating, across Arlington Heights Road. My dad was in jail, so he couldn't pick her up. I was told that the hospital had no choice to release her because she could not pay for the addiction unit. Today, even with insurance, inpatient treatment is staggeringly expensive. Which one of you could pay $50,000 out of pocket? Could you pay that twice? Neither of my parents lived to see 50. My dad was 43 years old when he died of an overdose in my grandma's arms, her only child, born on her birthday and dead in her arms. He bought his last hit 20 minutes from where I stand today. My mother was 49 when she died at Alexian Brothers of a liver infection, the consequences of hepatitis from heroin needles. My uncle died at 56 of an overdose in a stranger's home, someone we didn't even know. Opioid addiction is a family and community disease. We all have it, but it is one that can be cured. If there had been treatment for my parents, my sister and I may not have had to raise ourselves. I cannot describe the emotional trauma that we have learned to live with. My grandmothers, who were your neighbors, who owned homes, worked, and lived in these suburbs, would not have had to spend years in fear of their children's fate only to watch their children die. My children would have had grandparents, and I would have had them to call on for their wisdom and their support. The social services of our communities, schools, village services, police, food, and income support would not have had to be expended in an attempt to stabilize an unstable family. Some of you fear the men and women who will be treated at Haymarket. I am here to tell you that they live on your block, attend your church, shop in your grocery store, are the parents of your children's friends, are your children's friends. And they are far more dangerous using at home than getting treatment at Haymarket. These fears are not supported by logic or by evidence. To be clear, drug addicts are not dangerous when they are seeking treatment, and especially not when they are inpatient. They are dangerous when they are seeking drugs and the means to pay for them. My fears are lived realities. The reality is that drug seeking is dangerous. The reality is that raising children in a home with drugs is dangerous. The reality is loved ones trying on their own to stop their child, their spouse, their friend, their parent is dangerous. The reality is failure to treat opioid addiction has been proven to be dangerous in the statistics of our dead children, dead parents, dead friends, dead neighbors, dead opioid addicts in DuPage County. When you stop drug treatment in a safe facility such as Haymarket proposes, you make the community unsafe. You have not only an opportunity, but an obligation to make a sound decision based on facts and not fear. I implore you, from the bottom of my broken heart, to allow Haymarket to offer hope in treatment. I know Itasca is a little town, but it can be a giant in saving lives in DuPage County. Thank you.
Thank you for your comments.